All right, so we will get started. Good afternoon, everyone. My name is Victoria, and thank you for attending this month's Teach Educational Round. Today we have Nadia and Alexa presenting Cannabis Youth and Indigenous Peoples.
Hi there.
If you are interested in obtaining a letter of completion for this round, please make sure that you have one, registered for the webinar and completed the pre-learning assessment. Second, signed in to view and participate in the live webinar using your first and last name. And finally, complete the evaluation and post-learning assessment after the webinar, which you will receive a link for by the end of tomorrow. You will have 1 week to complete the evaluation and post-learning assessment. Please also note a copy of today's presentation slides will be sent along with a recording of this webinar by the end of tomorrow. This webinar is also being live tweeted on Twitter. You can follow us at PSQuitSmoking and use the hashtag TeachWebinar to post or read questions. Our presenters today are, again, Nadia Green and Alexa Harris from CAMH. And Nadia is a master's prepared nurse and has worked at CAMH for over 3 years, contributing to Indigenous initiatives and projects. She has worked in research and as a clinical instructor and course instructor at the University of Toronto. Alexa is a member of the Métis community and works as a social worker and therapist with a focus on addiction and trauma-based intervention at CAMH's Aboriginal Services. All presenters have confirmed they do not have any conflicts of interest to disclose, and potential sources of bias outlined on the following slide have been mitigated by making this information accessible and available to all participants. Please note that the content of the Teach Educational Rounds are centered on evidence-based guidelines from following sources. These materials, as well as the verbal presentation and any discussions during the webinar, are only general principles, and they do not replace the need for clinical assessments or treatment plans by healthcare professionals. And a final reminder for all of our new attendees that have joined us, I want to navigate your attention to the instructions on the screen right now. If you can click on the chat icon, it is a speech bubble icon at the bottom of the slide. That should open up a chat room on the right-hand side panel. And to make sure that all of our presenters and attendees can see your question, please make sure you are selecting all participants from the drop-down menu. And with that, I will leave it to our presenters to take it away. Thank you, everyone. I hope you enjoyed the webinar.
Thank you very much, Victoria.
Yes, thank you, Victoria. So hi, everyone. Thank you for joining us today for our presentation on cannabis use and Indigenous peoples. My name is Nadia Green. I'm the Knowledge Exchange Coordinator for Shkabe Makwa at the Center for Addiction and Mental Health, and I'm here with my colleague.
My name is Alexa Harris. I'm a social worker and clinical therapist with Aboriginal Services, also here in CAMH. Tanshi and Miigwech.
Thank you. So for today, we'll be covering the current context for cannabis and its use in Indigenous peoples and communities. We'll also go over the implications associated with cannabis use and the legalization, as well as discussing clinical recommendations and resources. So our agenda for today is we'll go over the historical context in relation to Indigenous peoples, and then we'll go over the current cannabis trends, followed by legalization, Indigenous rights and regulations, and then we'll follow that with Indigenous perspectives and clinical perspectives, and then provide you with some recommendations. And so to begin, historically, cannabis has been found to be present in Indigenous culture. This dates back to about 800 AD by some accounts. They found hemp pouches that were actually weaved together, and these pouches were used to hold other Indigenous medicines such as sage, tobacco, and cedar. As well, pipes have been found, about 500-year-old pipes in Morriston, Ontario. And from some elders, the purpose was said to be for spiritual use as well as topically for pain. So in terms of spiritual use, Indigenous people would use the pipes, they'd essentially smoke but not inhale the pipes, and this helps them enhance their connection to prayer and for connecting to the Creator. And as well, some individuals experienced euphoria, and this enhanced their visions during ceremonies. And for topical use, what they would do is they would grind down the cannabis and hemp, and with that they would extract the oil and apply that to areas where an individual was feeling pain. And usually this was in the joints, and so it would be for arthritic pain. One thing to note about the pipes, so they had found resin within the pipes, the bowls of the pipes, and so this is how they found cannabis and hemp to be used. In some Indigenous nations, some Indigenous nations might use cannabis while others don't. So just to keep note that it might be acceptable in one community and not acceptable in another. So make sure not to generalize the use of cannabis as a medicine. So next, sorry. So for our current trends, 12% of First Nations in a 2015 to 2016 survey had used cannabis, and for Indigenous adults who were entering treatment, 64% of those had said that they were currently using cannabis. And cannabis is the #1 substance used amongst Indigenous youth at 89%. And the second substance used by youth is alcohol. About 15.8% of Indigenous students had said that they were using cannabis in the 2017 to 2018 year, and this was compared to 2.4% for the non-Indigenous students. And 55% of Indigenous students said that they had used cannabis in their lifetime, and 46% had said that they had used in the last year. And amongst Indigenous youth who had sustained injuries, 4.5% of them had said that they had been using cannabis at the time. And so these stats, they indicate that our Indigenous youth are those that are most using cannabis at this time. And there's been some discussion around increased use since legalization of cannabis. And so right now this is just for the general population, and so it has not been delineated down to making suggestions around Indigenous cannabis use. And so at this time, that information is not available. And so that brings us to cannabis legalization. The Cannabis Act was proposed in 2017, and this is also known as the Bill C-45. And in June 2018, it received assent and then was legalized on October 17, 2018. And this allowed provincial and territorial jurisdictions to determine who can sell cannabis and how it would be sold. The locations of the stores and who would be operating stores. It's also allowed them additional restrictions, or to impose additional restrictions in terms of the possession. In terms of possession, the age limits, where people would be allowed to publicly use cannabis, and whether or not persons would be able to cultivate it personally. And so in Ontario, the legal age is 19, and this coincides with our age for using alcohol, as well as the buying locations. So they're privately licensed stores, as well as the online government-operated Ontario Cannabis Store. So these are the only two legal locations that you'd be able to purchase cannabis here in Ontario. And in terms of public possession, the limit is 30 grams of dried cannabis, and so this is equivalent to about 1 ounce of dried cannabis. You can also find the other forms of, or the equivalent of 30 grams in other forms, such as a liquid form, edibles, and as well as solid form. You can find further information on these different forms of cannabis on the Ontario.ca website under Cannabis Laws and Section 3. And there's further information around Ontario-specific information there. And so for every cannabis product here in Ontario, there's an excise stamp that indicates that it's a legal product. And every province has its own specific stamp. And so when we consider all of this together, there actually hasn't been, sorry, there's just, the comments keep popping up on my screen. So when we consider all of this information together, I think what's left out is the conversation around Indigenous rights. And so we can see this in the media as some of these headlines suggest. So First Nations say land title gives rights to cannabis use and sales. And then First Nations demand control over cannabis sales. Cannabis must respect Indigenous cannabis laws. And one of the greatest paradoxes, Indigenous communities grapple with the costs and benefits of legal weed. And so during this whole process, there's issue around engagement in relation to Indigenous rights in terms of land use and benefiting from being able to, sorry, what is it? In terms of Bill C-41, people were not engaged, and so the land use reconciliation wasn't really considered. And so all this movement for the government in terms of reconciliation in the last few years didn't really take into consideration the rights Indigenous people have to the use of their land. And so despite that, the government did say that they had engaged multiple communities and Indigenous organizations over the span of 3 to 4 years, so 2016 to 2019. They had engaged over 140 organizations and communities throughout Canada. And specifically in Ontario, I found that they had engaged 5 Indigenous organizations. So in 2016 and 2017, they engaged the Chiefs of Ontario. In 2017, they engaged Aboriginal Shelters of Ontario. And then in 2018, they engaged the Union of Ontario Indians, the Métis Nation of Ontario, and Ontario First Nations Economic Developers Association. And so considering the number of Indigenous communities, First Nations communities that reside in Ontario, there's over 130. I feel that this representation of those communities is a bit lacking in terms of being able to properly develop these regulations with the needs and to meet the needs of these Indigenous communities around cannabis legislation. So in So following this, though, the government did implement a fund, so $4.4 million to fund Indigenous organizations and community projects, but this was solely around educational resources to help, I guess, inform these different communities about the Cannabis Act. And what that entails and how that's going to impact people. And so this was supported by Health Canada and was supposed to start in 2019-2020. Unsure at this time whether or not that has actually been implemented and whether or not Indigenous communities are actually benefiting from this funding. And so what has also come from this is the Cannabis Act being translated. And so we have Cannabis in Canada, the Cannabis in Canada infographic. As you can see, it's centered. That one is in English. And then we have 4 other translations of the Cannabis Act into Indigenous languages. And so on the top left, we have Inuktitut. On the bottom left, we have the Swampy Cree. And on the top right, we have Ojibwe. And on the bottom right, we have the Plains Cree. And so all of these 4 resources have been translated into Indigenous, those 4 Indigenous languages. But again, this is just a small representation of the Indigenous communities that we have across Canada. And so it only speaks to a few of those communities. I think we have about over at least 70 different languages that represent our different Indigenous communities here in Canada. And so this is just kind of a small step forward in terms of bringing everyone, getting everyone on the same page about the Cannabis Act. And then also it doesn't really address the need for the legislation to include Indigenous rights. So that brings us to our Indigenous Cannabis Law. So amendments do need to be made to the Cannabis Act to respect Indigenous rights here in Canada. One article essentially said that it was bordering on racism, the exclusion of Indigenous people and their perspectives in the development of the Cannabis Act and the regulations surrounding it. And because it constrains Indigenous rights, it disregards the control over the use of Indigenous land. And so it's similar to enactments that have been placed or done in the US. So we need to transition to having Indigenous cannabis laws because this will help us recognize our rights to self-governance and our entitlement to our lands. And so that we can benefit from the sales of cannabis crops and selling of those crops, as well as to have the ability to ban cannabis use like on our land, so the development and use of cannabis. So essentially right now, the province has jurisdiction over who can sell and how cannabis can be sold. And this totally disregards our rights to self-governance. And so in terms of taking control, carefully exercising jurisdiction to control cannabis will benefit our communities and not put our rights at risk. And this is from one of the firms here, the law firms here in Canada, in Ontario, in Toronto, the Alpheus Clear Townshend LLP. And so this is taken from their website, and they provide advice in terms of law development and understanding a bit more of Bill C-45 and cannabis regulation. And so if you want to learn more about, I guess, the law surrounding the Cannabis Act and what we can do in terms of, I guess, imposing our rights on the law, the Cannabis Act, you can turn to them for guidance. And they consider specifically community needs and goals, and so for communities to be able to meet their needs in relation to the Cannabis Act. And as well, like this will, so controlling cannabis will help us protect our vulnerable people within our Indigenous communities. And again, our youth are the ones who are using cannabis more, and considering that Our youth are the fastest growing population here in Canada. I think it's something that we need to be more conscious of and considerate of.
Amazing. I want to say merci and miigwech to Nadia for giving such a comprehensive look into the structural perspective of our topic today about cannabis legalization and Indigenous populations. What I'm going to be doing is a bit different from Nadia. As Nadia set up the framework to talk about these structural implications, I'm going to look more at the clinical perspectives of cannabis and Indigenous people. And my perspective both comes from my work at Aboriginal Services as a social worker and clinical therapist. But I'm mainly going to be utilizing a micro perspective or impacts on the individual rather than on the communities and systems. And with that, I would like to first take some time to just make some considerations. When we're talking about the relationship between Indigenous people and cannabis, these are some of the first thoughts that came to my mind. And as Nadia alluded to, there's not a lot of evidence. So this is really where my mind went to is, are Indigenous people using cannabis more since legalization? Is there a difference between the impact of cannabis legalization and the availability of alcohol? What are the structural impacts on Indigenous people individually since cannabis legalization? Has the impact been good or bad or maybe just neutral? But what we can say for certain from all of these considerations, implications, is that it's far too early right now to answer any of these definitively. The information just isn't there. We are seeing a lot of information about the general populations within Ontario and Canada, about their relationship with cannabis, but we're just not seeing it for our people. Which brings me to my next point. Is, hold on here. All right. So, for example, in a study from 2015 to 2017, it found that Indigenous people were disproportionately arrested for cannabis possession. At this time, Indigenous people made up 4.3% of the Canadian population, but they comprised 23% of federal inmates. So this is pre-legalization when this statistic took place. And this is a very good indicator of the disproportional perceptions of Indigenous people in Canada regarding substances and regarding possession. And what we can see from this now is, unfortunately, Indigenous people now make up 30% of federal inmates, and little evidence today to suggest if there even was a change since legalization. And right then and there, that's where we have the biggest issues, is that we can make acknowledgement saying that our people are disproportionately arrested for cannabis possession. But once legalization happens, we are not able to come in and say, hey, was this a benefit or was this a deterrent for our people in our communities? And that's really the biggest impact that we as Indigenous clinicians, social workers, and nurses face, is trying to find that correct information. But the reality is, of government, educational, and institutionalized led studies and Indigenous people is that the empirical evidence is not accurate. And that being said, it's because we are scared to go and do government-led research studies. We are not considered as priority within government-led research studies. And then on top of that, they're going to be skewed. They're not going to be representational, and we need our people to lead these types of studies in order to gather the empirical evidence that we need to be able to make good understanding and good decisions based off of the evidence and the facts that are out there. So because of that, as Nadia alluded to, and I will allude to throughout this, is that it's far too early to tell what this connection is, and it may never actually come to fruition as accurate because of what we know within our Indigenous people in our communities and institutional or government-led studies. So with that, I want to shift perspectives from a legal perspective and think about what we as clinicians are doing right now to help our people and to help others in communities in Canada with cannabis use. We are taking a harm reduction perspective. And that's the acknowledgement that many people are using cannabis as a means of harm reduction from other substances. With this in mind, harm reduction clinicians only treat the identified problem. We don't assume that cannabis is a problem. So if a client comes into Aboriginal Services and speaks with me and says, you know, I am using marijuana daily, but I'm here to work on my opiate addiction. We do not treat the cannabis. We only treat what that client says, and that's the true perspective of a harm reduction clinician, is to be able to take a back seat and be able to understand what that client's view is of the substance that they are utilizing. And just even to go further with this, in a recent study, which claimed to consider what alternatives individuals use as a harm reduction approach to their substance use, the vast majority of the people in this study, which was done in 2019, so pretty recent, it described using cannabis as a safer alternative for alcohol, illicit drugs, and pharmaceuticals based off their own perceptions of less adverse side effects, low risk for addiction, and greater effectiveness at relieving symptoms such as chronic pain. What we also know about cannabis is that it is a prescribed medication. So within a harm reduction perspective, we listen to what our clients, what our patients, and what our people are saying about this. And when we look at cannabis use in Indigenous people from a micro perspective, it's about the perspective of what they are experiencing individually. And that's why I think it could be very hard for us sometimes to be able to support empirical evidence or good data within our clinics, as they're just not there. Additionally, I think it's important to also note that in our clinic at Aboriginal Services, we have a lot of clients that practice traditional ceremonies, laws and traditions, meaning that prior to ceremony, sweat lodge, pipe ceremony, they won't, part of their teaching is to not use substances for a period of time before that ceremony takes place. Our service is different. We understand from a harm reduction perspective that we need to be available to help our clients, regardless if they've just used. So we talk to our clients, we support them around their teachings, and we support them around what they need as best practice. It's a little bit of extra work, but in terms of providing client-centered care, Indigenous-centered care, we are giving the strength of our client's narrative, of their story back to them, allowing them to dictate how their understanding of their substance is going to impact their lives. So with that, I think it's really important to highlight the client voice, or the patient perspective. And what I have done here is I've collected and comprised a list of a few things that I have personally heard from clients, from patients at Aboriginal Services, whether they are inpatient and forensic units, whether they are outpatient, or maybe I've only seen them one or two times. I comprise this list with the idea that it's going to show a different perspective, that there is good and bad when it comes to cannabis use in our people. And I don't want to shy away from the good or the bad. So this is what I've heard. Cannabis is helping me not to use alcohol. I do not like drinking alcohol and smoking at the same time. Because people are talking about cannabis more and more, I am triggered every day. CBD is helping me with my chronic pain and anxiety. As more people use cannabis in public, I feel triggered to use more. With legalization, I now know what I'm getting in my cannabis, which has been a major factor since legalization. And we've heard this one a lot. And then lastly, a harm reduction approach lets me feel comfortable to tell my clinician when I use, as I know they will not judge me. And this is imperative when working in Indigenous populations because of the connotations that we have around substances and ceremony. And we want to assure that our clients and our patients are feeling supported with no matter what they're going through. And for us as clinicians to be able to be there to lend an ear non-judgmentally allows our clients to feel comfortable in the setting that they're at and ask for help. And what we can offer is education. So that's going on to my next slide, is clinicians' recommendations for safe use. And I want to preface this by saying that all of these recommendations that I'm going to be talking about in the next couple slides come from CAMH, and that these are all available on the CAMH website in a very nice and neat PDF format that talks exactly about the safe guidelines for using cannabis. It's not specific to Indigenous people, but it's specific to cannabis in general. And this is the empirical data that we do know about. These are things that we can utilize as education and talking points with our clients because these are the things that we do know have data around. So this is what we can offer. Always talk to a healthcare professional before using cannabis, especially for the first time. Talking openly to somebody, asking about the questions, about the risks, wanting to know about safe use is imperative. And I want to be able, as a clinician, to allow my clients to feel as though they are able to talk openly about cannabis with me, and that when I talk about cannabis, there's no connotation around it. There's no negative and there's no positive. It just is. And that allows my clients in our service to feel as though, okay, when I'm in need of getting some information about this, I know I can talk to somebody about it without judgment. I know if I tell them I have sweat tomorrow and I use cannabis today, there's not going to be judgment. We are there purely to support them. Going further into what we know about cannabis and safe use is that we want our clients to understand the risks that are involved with cannabis use because there are risks. For one, high amounts of THC has been proven to cause psychosis in a small percentage of people under the age of people under the age of 25 are at a higher risk of this happening. And it's been correlated to the fact that youth brains are not developed until they get to about 25. And as Nadia alluded to, one thing that we do know, which is amazing in terms of Indigenous people and cannabis, is that youth are our predominant users. So with that, we need to have the education as providers to be able to say, hey, this is happening. We know it's going to happen. Let's find ways that we can make it safer. And the biggest way is to decrease that THC amount. So other things that we need to tell our clients or our patients are that cannabis can affect your thinking, your physical coordination and control. It can have an increase to accidents, including injuries or reproductive issues, mental health problems, including dependence, depression, lack of motivation. Smoking cannabis can increase your chance of having lung problems. There's always going to be side effects when you put something in your body. And knowing the risks involved make those side effects at least now tangible. They're not a myth. If we're able to say concretely to our clients, this is what is possible, this could happen, I think back in the day, we all used to tell ourselves that it's impossible to become addicted to marijuana. That was the old creole. And as we're learning more and more about cannabis, that is not the case. And by even telling that to our clients or our patients, that this is the reality of cannabis and there's ways to utilize it safer, I think it kind of brings down the mythos of what cannabis is. And it breaks it to be a real, viable, and tangible thing that people want to learn about. So with that, I also recommend to my clients only purchase cannabis from a provincially approved cannabis store. And that is Ontario Cannabis Store, which is online. Going to one of the stores that is approved by our governing bodies here in Toronto, something like Honey Pot, something like that. The purpose around this is that they are the people that are able, the customer service representatives, my apologies, in these stores and on the Ontario Cannabis Store, it shows you the exact amount of percentage regarding THC and CBD, exactly what you're going to get in your product. We do know from the Toronto Drug Strategy System that there have been reports lately in Toronto in the past, I think, 5 years that we've seen fentanyl laced in marijuana. One of the best things to come out of legalization is the fact that clients and patients don't have to now buy their substance from an unreliable market, so buying from dealers. Now clients are able to know exactly what they're putting in their body and these risks associated with it. More so for what I work with my clients and I try to tell them, and I alluded to earlier, is that if you choose to use a low strength product. Low strength meaning low THC. And those, such as those with lower THC, but a higher CBD ratio. A lot of our clients are saying, I want to use marijuana for its medicinal properties. And that's where CBD comes from. The THC is not going to give you those medicinal properties like anxiety relief and chronic pain relief. But what we do see is that THC is the psychoactive drug. There's still psychoactive elements within CBD, but you're less likely to have psychosis or high anxiety when you're choosing a lower THC to CBD ratio. And this is predominantly found in indica cannabis over sativa cannabis. So what we're seeing now is that indica cannabis has lower THC levels than sativa cannabis. Another thing that I also want to demystify when I talk to my clients about the reality and the risks involved of smoking cannabis is that smoking is the most harmful way of using cannabis as it directly affects your lungs. There are safer and non-smoking options like vaping or eating edibles that are better for your lungs, but keep in mind these alternatives are not risk-free either. They also have high amounts of THC that can cause the same type of distress like psychosis, depression, lack of motivation that you would get from inhaling cannabis. So always, when talking to your clients or talking to people in the community, or even if this is for yourself and your own knowledge about marijuana use, look through what those levels are. Make sure that you know what is in your product and make sure that you are always aware of the risks that are involved when utilizing cannabis. We know from what Nadia had shared that our Indigenous youth are using this product, are using this substance. With that reality, we need to be available then to be able to come in with knowledge to provide a safe measurement for them, a safe place for them to be able to talk and address their issues or fears or maybe not even considerations about cannabis before something bad happens. And then my last thing to end on is avoid using cannabis alone, especially for the first time. That's something I always tell youth, is that if you use cannabis alone and something happens, like it triggers a psychotic event, and you're alone, no one's there to help. So if you do use with somebody else. Use with somebody who can get support if needed. If something happens and you need to go to the hospital, there's someone there. And then lastly, I want to say, of course, never use cannabis and drugs. That's my biggest last end off, just in terms of keeping people safe and knowing about the risks and harms involved. So with that, that is the end of our context portion for today's presentation and teach webinar. What Nadia and I would like to do now is go over to some of the questions and be able to field some of the questions that you guys have. So please put your questions in the Q&A box. And I see we have a couple already. And we will we'll be able to kind of go through those. So Nadia, do you have anyone that you would like to take over?
So I think the most recent, I don't know where we should start from the top.
Yeah, I think maybe in terms of Gemma, we are recording this session. It will be sent out. There also will be a PDF. I believe it will be sent out by end of day tomorrow. In terms of the messaging regarding vaping, related risk in terms of recent sudden onset vaping-related respiratory illness, that's a really good question, and that's one that I need to preface. And Nadia, is it okay if I take over on this question?
For sure.
So there is a difference in terms of vaporizing dried cannabis and using liquid forms of cannabis and vaping. What we're seeing is the issues from the liquid form of vaping cannabis. That's where people are talking about the pop lung, the issues in terms of the onset to respiratory illness. However, in terms of vaping it, which is not burning the cannabis, but heating it to a point where you get a vapor trail of the THC and CBD that will then enter in your body into your bloodstream. So there's two very different versions in terms of vaping when it comes to cannabis use. And I apologize that I didn't include that in my presentation. That was a really good question.
Great. And so the questions that I see, so what is the website called again? I think this was in relation to the CAMH website.
Yes.
Yeah. So the Center for Addiction and Mental Health. So you just type in camh.ca and you should find us quite easily. And then the other question around cannabis that is sold on Ontario provincially approved. And so this would be, it depended on whether or not the community itself has actually gone through the regulation process. So whether or not they've talked with the provincial government to kind of have that set up. But at this time, it's right now, I think that's the only way that a community or reserve would be able to kind of have that implemented without, I guess, breaching, like going against the law, essentially. So, and I think that's where these issues in terms of Indigenous rights come into play. So right now, again, that ability to have cannabis crops on Indigenous land has to be provincially approved.
Absolutely. And I'm just adding in a question that was in our chat that wasn't in our Q&A that I would like to address as well. So someone just asked, can you please repeat the info about the different kinds of cannabis vaping? So just to quickly answer that question, there's a liquid form of cannabis, which is what you're normally seeing in terms of what people are vaping with in terms of nicotine. They are vapor oils, and they are not good in terms of effects to respiratory illness. We're hearing a lot right now about the popcorn lung and people who are having quick onset of death because of this type of vaping. So what safe cannabis measurements are saying is, instead of using that oil cannabis, which is legally sold at cannabis stores right now, they're recommending to vaporize your dried cannabis flower in a vaporized machine, which does not burn the cannabis, but vaporizes it until the THC and the CBD is extracted into a vapor trail. And I'll answer the question about youth services. That's a really good question from Dennis, who says, how can youth services in the province make more of an effort to emphasize harm reduction principles in their program delivery and reach their demographic? I think the biggest thing that we can do is have signs, have literature around that shows that this is what we want in terms of supporting our people. Right now in CAMH, we do a really good job of, making sure that we have signs available that say it's a safe place for LGBTQ too. I think that we could also incorporate signs that are saying this is a safe place to talk about substances, that this is not a place that we're going to turn you away or judge you for your use. Even having signs available that say, this is what we know about safe cannabis use. These are imperative to start the dialogue with our youth, to start the dialogue with our communities about this relationship, because it's not going to die off. The relationship is still going to be there. And the best thing that we can do is come in with education.
Mm-hmm.
Really good question.
Yes. There's another question here that I see. I'm not sure who it's from, but it says, medical marijuana, do you see this eventually being covered through NIC, so non-insured health benefits? I think right now, at this time, there's still negotiations that need to be made in terms of getting Indigenous rights amendments for the Cannabis Act. And I think following that, which is probably going to take a while to kind of get going, before we can start thinking about this being covered by NIHB. And so once we are within the Cannabis Act and our rights are respected in that way, I think then that's when this discussion will take place. But yeah, I definitely think that medical marijuana, it should be covered for our Indigenous people. I'm not sure. Do you have any comments around that, Alyssa?
I definitely do. I think, when we look back at the information that was presented by Nadia today, and that when it comes to reconciliation and land agreements, there's a lot that has been bypassed in terms of our self-governance as Indigenous people in Canada. And having that access to our non-insured health benefits, I do believe that would be an act of reconciliation. Mm-hmm. And these are these steps that we need to take day by day to see progress with the relationship between our government systems and within our people. I'm seeing another question here in our chat from Heather. It says, I think your harm reduction approach is great and it makes complete sense. We work primarily with pregnant youth. Would your approach change if your client is pregnant? As we do have some evidence related to the effects on the baby from cannabis use by the mom. That's a great question. And Heather, I do work with many mothers that are pregnant and that have used cannabis and using it. And what I have done is I've said to them, you know, this isn't my specialty, that working with a pregnant mom is not my specialty, and that there's a life force inside you, and I don't want to make any assumptions based on my own knowledge of trauma-informed mental health practices and addiction practices. So the first thing that I do with those clients is I talk to them about making a phone call with me to Nadia Child to see if we can collectively work together to find Indigenous-based supports for that mother and baby connection. And whether that be them supporting them getting off the marijuana or titrating it down or whichever it is, it is something in which that I do believe that I need the best people to support my clients for, and I acknowledge that I'm not one of them. So utilizing my resources in my community is to my utmost strength that we can do to support our people best. So if I have a pregnant youth, a pregnant mother, anything, my first step is always to call Child Native Services or CAS, whichever the mother would prefer. And that's also an open discussion for me and that mother as well. Really good question. Thank you, Heather. Are there any other questions? Ooh.
I have some questions that we've missed.
Okay, yeah, go for it.
Read them back to you, and hopefully we can get a response. So one is, how do you help people understand the amount that you should take for an edible? I ask this because older adults tend to use too much because they don't get the desired effect immediately, and the delay in the response results in people taking more.
Yes. Nadia, do you want to cover that one, or do you want me to? I know you covered a bit about edibles and...
yes, and so, yes, for sure. So on the Ontario, I think it was ontario.ca website around cannabis possession and the equivalency amount, that's where you can find the information that will help you determine, I guess, the safe amount, because the amount in an edible can vary, but because of the Cannabis Act, there should be lower amounts within edibles now, and so that's regulated. So you can definitely check the site there to see what those equivalency rates are so that you can be within a safe range of use.
Absolutely. And just to piggyback off of that, Nadia, in terms of safe clinical recommendations for what we do tell our clients for edibles is to start really slow. Whether you're using a tincture for that's like a liquid form or an oil form that you put under your tongue, eating a gummy or chocolate bar, whichever, start by just eating the smallest amount and wait 2 to 3 hours. After that, then slowly start to integrate more if you don't feel the effect. But the idea is to start very, very slow and at only ingesting a very minimal amount and then increasing it until the desired effect is there. Because yes, it can come very quickly if you eat too much at first, and then a few hours later, people have experienced some really bad psychosis symptoms from doing that, and depression and anxiety. So great question.
Thank you. One more question is, what has been your messaging regarding vaping-related risks in terms of the recent sudden onset vaping-related respiratory illnesses?
Yeah, I can feel that one. Our biggest, what I always recommend and what we've seen in terms of the data is that liquid forms of vaping, so it comes in like a little cartridge about maybe this big, and it's an oil-based THC or CBD, THC and CBD compound that is then turned into a large amount of vapor that enters the lungs. We've seen this with nicotine, which is very popular right now, which is the liquid nicotine version that people are smoking. And what we're seeing is something called pop lung, and in people having a sudden respiratory illness. And within that, what we do recommend is vaporizing dried cannabis. So purchasing a vaporizer and only utilizing dried cannabis for that reason. This is a much safer method, as you do not burn the cannabis, you vaporize the cannabis in a hot almost oven, and that way it's a less risk on your respiratory system.
Thank you. And I think we have time for a couple more questions. One question that we just received is all cannabis sold on Ontario reserves equivalent to contraband tobacco sales? For example, not government safety checked or authorized? Or are there sources of Ontario authorized cannabis available for purchase on reserves?
I think that's a very interesting and thoughtful question. Yeah, at this time, it's hard to say. Yes, the information, it's hard to sift through all the information around, I don't want to coincide it with contraband tobacco. So especially when we're thinking about Indigenous rights and land entitlement as well. Yeah, I can't really say much at this time regarding this, just because I don't have that information on hand. Yeah.
And I think in terms of what we can say is that there has been very minimal news about what Indigenous rights are about growing marijuana on reserve land. That has been very convoluted, and it's like reading mud right now. It's problematic in its own right. Great question.
Okay, so that will be the end of our Q&A. I know there are a couple more questions we didn't get to address. If you do want to reach out to the presenters, you're welcome to with your questions, and hopefully they can provide you with a response. For the resources included in this webinar, they're listed here on this slide, and the slides will be available to you tomorrow along with the recording. I also noticed that someone asked for the link to Ontario's guideline on safe amounts of cannabis. I'm wondering if Alexa or Nadia, you can forward that link to me and I can distribute that along with the recording and slides.
Absolutely.
As well, thank you. As well as the link to the CAMH guidelines.
No problem. Excellent. Yeah, thank you guys so much, Merci, Miigwech, and thank you for taking such an active role in our wanting to learn about our people and our communities. So thank you so much for being involved.
Yes. Thanks, Alexa, and yes, thanks everyone. Thank you for joining us during this lunch hour. Take care, and we hope you all are well. Thanks.
Thank you. Bye.
Just a final reminder before we sign off, this webinar has been recorded and will be distributed with the slides. And please make sure that you do complete the evaluation and post-learning assessments. The links will be sent to you with the resources. And if you participated in the webinar as a group, please make sure you email teach@camh.ca with a list of the names who you attended with by 3 p.m. today. The next educational rounds will be, the title should say, Feeling Stressed, Don't Light Up, and it will be presented by Dr. Wayne DeRuiter on June 17th, 2020. Registration will open soon. If you missed a portion of today's webinar or you're interested in viewing it again or visit any of our previous webinars, you can visit the archive list that can be found on our website. Thank you again, Nadia and Alexa, so much. It was really interesting to hear you describe the overall and client-focused links between cannabis use and Indigenous peoples, and it sounds like a lot of our attendees are leaving with information that they did not have before. So thank you very much.